Welcome back to Alpha Talk, guys. Today we have a biotech company with the potential to change a lot of lives. So what we're talking about is Paratek Pharmaceuticals, a commercial stage biopharmaceutical company which focuses on the development and commercialization of life-saving therapies for life-threatening diseases or other public health threats for civilian, government, and military use. Its lead product is Nuzira, a once-daily oral and intravenous broad-spectrum antibiotic for the treatment of adult patients with community-acquired bacterial pneumonia and acute bacterial skin and skin structure infections caused by susceptible pathogens. The company has license and collaboration agreements with Zai Lab and Allergen, including a license agreement with Tufts University to develop and commercialize products for the treatment or prevention of bacterial or microbial diseases or medical conditions, and cooperative research and development agreements with the U.S. Army Medical Research Institution of Infectious Disease to study Nuzira against pathogens. Antibiotics were invented in 1928, and no new classes of antibiotics have been invented for decades. The last major breakthrough came in 1984. The process of producing new antibiotics takes anywhere from 10 to 20 years, and antibiotics are used from everything from organ transplants to treating food poisoning. Throughout time, bacteria and microorganisms evolve. Some of them have been surviving against antibiotics and building up a defense to them. The more antibiotics we use, the faster the resistance forms. This is caused by misuse and overuse of antibiotics and is leading to superbugs. Deadly bacteria resistant to penicillin and the other more than 100 different antibiotics that have been developed since are killing 750,000 people per year, and this number could rise as high as 10 million and kill more people than cancer by 2050. These infections cost the U.S. $20 billion a year, with 160,000 Americans dying every year. Now, one company could change this: Paratek Pharmaceuticals. They're working on first-line therapies for antimicrobial resistant infections. Over the past 20 years, they have refined their drug with the help of big pharmaceutical companies. Omadacycline, sold under the brand name Nuzira, is effective against MRSA, skin infections, pneumonia, meningitis, sepsis, and is in phase 1 testing against anthrax for the U.S. government. Nuzira has been very effective in its launch in hospitals and just recently announced they are expanding Nuzira into a community setting so that it can be prescribed by physicians. They are vastly increasing their customer base here and will most likely see a massive windfall of revenue generated due to the expanded rollout. The revenue trajectory of Nuzira has far outpaced that of other antibiotics launched in recent years. This shows me that although it is relatively new to market, doctors need the treatment since others are becoming ineffective. Could this be the company to prevent superbugs and save countless lives? Only time will tell. Now, of the 5 analysts following this company, all 5 of them rated a buy, with 3 of them calling it a strong buy, and the high price target is $34. Thanks for watching, guys. Be sure to subscribe to catch the next one.